Hello, my name is Haley Parker, and I will be talking about mental health and COVID. As I stated, my name is Haley Parker. I am currently an English Studies major at Miami Hamilton University, and I am in my third year. Since the start of COVID, mental health has been declining rapidly. Mental illnesses are on the rise, and due to quarantine, there is a lack of options to assist with mental health. Telecounseling can be a great tool to assist with mental health. However, it needs to be improved upon to lessen the cases of exploitative counseling sites. Mental health has declined among more than just the general population. Even healthcare workers have been affected by the pandemic. As Jonathan Bryant Genever states in his document, symptoms of depression, anxiety, post-traumatic stress disorder, and suicidal ideation among state, tribal, local, and territorial public health workers during the COVID-19 pandemic, United States, March to April of 2021. A survey taken among healthcare workers during the COVID-19 pandemic stated, among 26,174 respondents, 53% reported symptoms of at least one mental health condition in the preceding 2 weeks, including depression at 32%, anxiety at 30.3%, PTSD at 36.8%, or suicidal ideation at 8.4%. Over half of those involved reported at least one mental health condition just in the previous 2 weeks. These are startling numbers for those directly handling the brunt of the pandemic. This issue is also not purely limited to the United States. As Liliana Dimitrac states in her article, Post-lockdown effects on students' mental health in Romania, perceived stress, missing daily social interactions, and boredom proneness. The pandemic has had lasting effects throughout the globe, as studied by another researcher. Zhang et al. Found relatively high rates of symptoms of anxiety at 50.9%, depression at 48.3%, post-traumatic stress disorder at 53.8%, psychological distress at 38%, and stress at 81.9% among the general population during the COVID-19 pandemic in China, Spain, Italy, Iran, the US, Turkey, Nepal, and Denmark, with the most exposed being females, the younger age group, and students. This highlights the issue of mental illness being a worldwide problem, which calls for more widespread solutions. There can also be less recognized reasons for mental illness being on the rise during the pandemic. According to Purnurna Varma in their article, Poor Sleep Quality and its Relationship with Individual Characteristics, Personal Experiences, and Mental Health During the COVID-19 Pandemic, sleep can be a major factor in mental health problems. Varma expands upon this by stating that out of 1,745 participants, almost 50% of the participants reported poor sleep quality, which was linked to a more negative emotional tone and greater mentions of money or finance-related words. Good sleepers reported more positive emotional tone in their experiences. Greater reports of clinical state anxiety, moderate depression, and moderate stress were observed in poor sleepers, even after accounting for demographics and pandemic-related factors such as loneliness, financial concerns, and risk of contracting COVID-19 disease. Even after accounting for factors related to COVID-19, those that failed to get good levels of sleep were more likely to suffer from mental illnesses. However, poor sleep is already something doctors are studying and working to treat. Linking this to mental health problems could likely offer more solutions in treating both. Moving on to telecounseling, in Rosaria De Luca's article, How the COVID-19 Pandemic is Changing Mental Health Disease Management, the Growing Need for Telecounseling in Italy, they state, telecounseling refers to any type of psychological service performed over the internet, including emails, chat rooms, and web cameras. It ranges from individual, couple, and group psychotherapy, with qualified therapists providing psychological first aid to those who need it. Telecounseling has been growing in popularity as COVID-19 has resulted in people being unable to complete tasks in person. A few reasons on why telecounseling is good. One of the reasons is that it is a benefit to the patients who use it. As DeLuca states, its use is for the benefit of the patient, protects patient autonomy, confidentiality, and privacy. As several methods of telecounseling offer text-based therapy along with other options, there's an option for everyone. This helps counselors meet their patients' needs rather than every patient having to resort to face-to-face therapy. This can also be cheaper than other forms of counseling, but it does depend on insurance. Due to the growing number of telecounseling apps, there are some scams mixed in with the legitimate counselors. I personally downloaded an app to set up a virtual therapy session, but due to the traumatic nature of things I would be discussing, requested only chat rooms. The counselor I was paired with would refuse to discuss things with me outside of our specific appointments, which was a feature proclaimed by the app, made small talk all throughout our appointment, and then told me she couldn't help me unless I switched to FaceTime appointments. As this had been a whole month with only one interaction, where my personal need for something other than showing my face had been rejected, I canceled my appointments and deleted the app. The billing cycle was also close to an end, which meant I almost had to pay another few $100s for essentially nothing. As Erica J. Seidel states in her work, Communicating Mental Health Support to College Students During COVID-19, an Exploration of Website Messaging, that out of 138 college websites studied, overall only half of the surveyed web pages provided information about remote counseling, and just under 2/3 of schools, 57.97%, had directions for students experiencing a mental health emergency. Even if remote counseling is available, oftentimes schools will not let students know it was ever an option. All of these issues must be addressed and corrected before telecounseling can be a good option for those struggling with mental health. The pandemic has caused a huge increase in mental illnesses across the globe. More people are suffering and a change needs to be made. Telecounseling is a vital tool in assisting with the mental health issues resulting from COVID and quarantine. However, there are flaws in the systems, and these need to be addressed and reworked before it can be a good tool. The main issues that need to be addressed are the scam counselors, the lack of advertising for remote counseling, and keeping a balance of attention between physical appointments and remote appointments. And these are my works cited. Thank you for listening.